This slide shows common types of assessments: formative, diagnostic, and summative, and the various times within instruction we use these types. Now, let's dig into diagnostic assessment. A student is consistently struggling and not responding to instruction as prescribed by the program or practice specificity. The next questions always become: what are they struggling with? Where are their gaps in understanding? And why are they not responding? This is when we can lean on diagnostic information. What is diagnostic assessment? Diagnostic assessments are often described by how we dig deeper into either formative or summative assessments to determine how to adjust our instruction. Why do we have diagnostic assessments? Because we want to measure a student's current knowledge and skills for the purpose of identifying a suitable program of learning. It can be used to identify areas of strengths and weaknesses for individual students, which can help teachers determine what to teach and help in the selection of appropriate interventions. When do we diagnostically assess? Diagnostic assessments do not need to be complete for all students, but you do want to purposely think about the reason for collecting diagnostic data, for which students and when. Diagnostic tools can be either informal, which are easy to use tools that can be administered with little training, or standardized, which must be delivered in a standard way by trained staff. Due to the amount of time to complete the formal standardized diagnostic assessments are used on an individualized basis. Formal standardized diagnostic assessments are generally administered to students when screening and progress monitoring data suggest non-response with the goal of identifying specific deficits in student learning so we can plan an appropriate intervention. These are various forms, both behaviorally and academically, that can be used to help hypothesize how to change instruction in hopes of determining responsiveness. Let's dive a little deeper into diagnostic assessment. Diagnostic tools provide data to assist educators in designing individualized instruction and intensifying intervention for students who do not respond to instruction as prescribed by the program or practice specificity. Because diagnostic assessments provide detailed information about individual student learning, they are often most effective in understanding the needs of individual students rather than all students. When there is a need to dig deeper and gather more information regarding a student that is struggling, to answer the questions: why are they struggling and how deep are their gaps in understanding, we will administer diagnostic assessments. The first avenue is, though, informal assessments, which we will discuss in more detail on the next slide. Informal assessments are less time-consuming to dig into for multiple students compared to formal assessments. Formal diagnostic assessments are more time-consuming and are often administered on an individual basis, so these are often only administered to students not responding to intervention. When informal information and analysis of formative assessments does not provide enough detailed information. Do all students need individualized instruction in Tier 1? No, but for those struggling, do we need to do another assessment? No. The first line of defense is to use informal data from our classroom that we can use to determine student need before having to use an extensive formal diagnostic assessment. These are examples of informal diagnostic tools that can quickly support educators in the classroom, making instructional decisions about practices, scaffolds, and differentiated supports to provide to students in the classroom. After these informal diagnostics are used to inform instruction and support, the students continue to struggle we would want to gather more formal diagnostic information. These more formal diagnostic assessments are therefore typically administered only to some students. Those that are consistently are non-responsive to instruction and need more information, or to have students who've been identified as being at risk for learning outcomes. This flowchart is a great example of a process to follow to diagnostically understand a student. Start with some exit tickets, observations, running records, quizzes you've made, and use them diagnostically. What concepts are the students struggling with? What skills? Is it the entire group or an individual? Do I need to circle back my teaching or revisit certain supports for specific students? And then if it becomes consistent and persistent struggles, are the students receiving intervention services? Are the struggles appropriate for grade level, or do we need more extensive information? When more information is needed on a student and informal assessments are not supporting a student's response to instruction, we can look at formative assessments students have taken and dig into them diagnostically. These are generally administered to students when progress monitoring data suggests non-response, with the goal of identifying specific deficits in student learning and planning instruction or an intervention. When using formative assessments diagnostically, we want to be sure that we consider students' cultural and linguistic backgrounds in the types of questions being asked for the students. We do not want this becoming a barrier in the assessment rather than being able to focus on the student's response to the math content. We want to ensure that the questions we're asking are relevant to the students. These is a list of formative assessments that we can use diagnostically, and it was adapted from the National Center on Intensive Intervention's website for examples of diagnostic tools. This is an example of error analysis of formative assessment data. This is common diagnostic approach that educators take in the Tier 1 general education setting. This could be an example of a student's practice problems, answers on a teacher-made assessment, or even the student response from a formal, standardized, valid, and reliable progress monitoring assessment that they are showing non-response to. In the example of Cole's problems analyzed, this could be used by a general educator to differentiate the instruction if the students are learning about regrouping and this content is grade level appropriate. They may need to provide Cole with more opportunities to regroup within place value using concrete and representations in connection to the subtraction standard algorithm. If Cole is a student above grade 3, he is going to need intervention in place value and regrouping in addition to supports and scaffolds within the classroom whenever students are applying the subtraction algorithm until he can accurately regroup and apply the standard algorithm or an accurate, efficient strategy. This is a great snapshot of how you can use your formative assessment data diagnostically to gather information and plan for instruction and intervention supports for a student without having to administer another assessment. If the informal diagnostics and use of formative assessment tools through the use of error analysis or student interviews did not provide enough detail, this is a list of more extensive tools that can provide detailed information on discrete skills and help students specific areas of strength and weakness. Due to the amount of time to complete, the formal standardized diagnostic assessments are not administered to all and are used on an individualized basis. These are typically only administered to students who have been identified as being at risk for learning problems and are non-responsive to Tier 2 intervention supports based on regular progress monitoring data. Many examples from this list came from the National Center on Intensive Intervention's website for examples of diagnostic tools. The last example, Some Diagnostic, is a tool that Ride's Department of Curriculum, Assessment, and Instruction provided professional development opportunities to educators and districts around the state. Please see the Department of Education's website for more information.